Hello everyone, my name is Dr. Ezioma, founder of TENDERLEE, and I'm here to talk about asphyxia in the newborn. So to properly describe it, we will use the term perinatal asphyxia so that it covers possible causes of asphyxia before delivery, during the process of delivery, and after delivery. Every mom will want to have a perfect delivery outcome. After carrying a pregnancy for 9 months, why would anything go wrong? But in reality, things can go wrong. We'll talk about what it means, possible causes, how it can be managed, and how it can be prevented, most importantly. That's why I'm here. So let's break it down the TENDERLEE style. So in simple terms, perinatal asphyxia just means that the baby is unable to get enough oxygen, and it can occur before delivery, it can occur during the process of delivery, or even after delivery. And so many causes are responsible for this, which we'll be talking about. These are the things that lead to the complications that these babies suffer from. But the truth is that early action can save their lives, and that's why we refer to the first 1 minute of a child's life as the golden minute. A lot can happen in that 1 minute, and it will just change the story for this child. So let's start with the causes. Before delivery, some of the causes of perinatal asphyxia include hypertension in the mom, poorly controlled hypertension. That's why you should go for your antenatal care, so that once it's noted, you can begin to receive care. Diabetes in pregnancy can cause it. Multiple gestation, severe infection in the mom. Some of these things are responsible for perinatal asphyxia in the baby. During the process of delivery, prolonged labor can cause it. So you have what we call cephalopelvic disproportion, where the size of the pelvis of the mom is not enough or wide enough to allow the baby pass. So the baby gets stuck in there, can't go back, and can't come out. Not a good place to be. The placenta can get detached from the wall of the uterus, which is what we call abruptio placenta. The mom may suffer severe bleeding, placenta previa. Even the drugs the mothers take just before delivery can affect them. Some of the anesthetic agents, that's why you should go to a place where you have skilled attendants who know the right things to do. When there's uterine technique, the process of labor is such that the uterus contracts and relaxes, contracts and relaxes. But sometimes the uterus remains in that state of permanent contraction, so the baby doesn't even have any breathing space. One such situation is where you want to deliver at the place of a traditional birth attendant. They don't know the dose of the drugs to use to augment labor, and they just give a very large dose, and the uterus just contracts, and sometimes the uterus actually ruptures. In all honesty, we've seen such cases. That's why you should go to the right place. We also talk about cord around the neck. Sometimes you hear the doctor say cord around the neck. It can go once, it can go twice. Sometimes, because if the cord is too long for the baby and the baby just swimming in the uterus, before you know it, the cord just goes round and round and almost strangle the baby. After delivery, some of the causes include swallowing meconium. The black poo they pull out when they are born. When they are in distress in the womb there, they pull it out right inside there and swallow it. In the process of swallowing it, it gets into the lungs and it goes to block the breathing sacs inside the lungs, and it's a problem for them. But these are some of the causes of perinatal asphyxia in children. So let's talk about the complications that these children suffer from, and I want to take them according to the different organs that are affected. So let me start with the brain. Ordinarily, when these children suffer from asphyxia, the normal thing is that blood moves away from certain organs of the body to the brain, the adrenals, and the heart to see how we can help to keep this child alive. When it persists, there's irreversible damage to these organs. For example, in the brain, which we know is the powerhouse of the body. These children are unable to suck. You see us sticking our fingers into their mouth to test for the suck reflex. When they are severely asphyxiated, these reflexes are lost. They're unable to suck, they're unable to swallow. We also want to check, are they having convulsions? It's one of the problems they have. And some are completely unconscious. It's a problem. In the long term, some of them have developmental delays. They're unable to smile when they should, which should usually be at about 2 months. They're unable to hold their neck, control their neck. This occurs at about 3 months. They are not able to sit without support at the right time. They're unable to crawl, they're unable to walk when their peers are doing the same things. It's an issue, and these are some of the things we want to, we look out for. They have reduced IQ, some have hearing problems, some are unable to see. It can be quite tough. Let's talk about the digestive system, so the intestines. So blood usually moves away from these places, and then when we see those babies, we do not start feeds. I mean, you don't want to give food to a baby when the blood has been shunted away from the intestines, and that's why we'll tell you, just hold on. We'll tell you the right time to start feeding, but if you do that, it's a problem. They may have ulcerations, and then they may even have distended abdomen and begin to bloat. What about their kidneys? They are unable to make urine, and so we want to check. There are some medications we do not commence until we are sure that they've made urine, because we don't want to cause more problems for them. Let's talk about the heart. The heart is affected, is unable to pump blood sufficiently for the rest of the body. And that's a problem for the baby. They have breathing problems. Remember, I talked about the fact that they can swallow meconium, and it affects their breathing capability. They are not able to exchange oxygen flow in their muscles. They may have reduced muscle tone or increased muscle tone. Either can occur, and it's an issue. So for perinatal asphyxia, some of the things we do as doctors, we want to basically prevent the complications or the long-term complications that these children may suffer from, and then arrest the process of insult and injury as fast as possible and as much as possible. Now, when your obstetrician notices that the heart rate of the baby in the womb is going haywire, they'll tell you this baby needs to go out. So they say the baby is there's a fetal distress, and we need to do a cesarean section to get this baby out, because the baby is already in enough problems. You don't want to make that baby go through the process of vaginal delivery. Please, that's not the time for you to say, I want to go to church and stay and pray. You can call your pastor to help pray with you in agreement while the process is going on. You can't suffer for how many months and then leave empty-handed. So please, listen to your doctor and then accept the process. When the delivery occurs, hopefully a pediatrician should be there to receive the baby, and then we immediately try to resuscitate this baby. So you want to get air into the baby's lungs as fast as possible, so that the brain gets oxygenated and then other organs of the body get perfused, right? So we carry out our neonatal resuscitation. You see us using a bag and a mask, and then we want to get in air as much as possible. We use oxygen, and we do different things that we do to help this baby. There's also something we call total body cooling or the head cooling, where the facilities are available, they do that because you just want to calm down the process of inflammation going on so fast in the babies. You want to help the babies with their feeding problems. Some of them, since they're not able to feed, we use infusion to make sure that they get enough energy and all that they need to sustain them to the point where we can commence feeds. The medications we give, there are some we do not give, and then there's a whole lot we do to help them in that situation. Yeah, so that's why you should have a pediatrician at your baby's delivery. And then prompt action will help. You know, if you have this baby at a place where there's no skilled attendant, by the time they discover, they start slapping the baby, they start beating, they start putting the leg in hot water, they do all sorts of things, time is going. Before you know it, the baby is still not responding. That's when they will now remember that, okay, let's move the baby to a hospital where there's a pediatrician. And all that time wasted will cause problems in this baby, which we do not want. We do not want it. So please, you can take your life in your hands. You can take your baby's life in your hands and make the right decisions early enough, so that at the end of your 9 months sojourn, you can go home with yourself and your baby intact. Now, so how can we prevent pet asphyxia, perinatal asphyxia? Yeah, so there are things you should be able to do as a mom, and there are things the doctors will do. Generally, you should go for your antenatal care. You should be empowered. You know, sometimes it breaks my heart when a woman, for one reason or the other, is not able to register at a proper hospital, and when you ask, they say there's no money. You ask the husband, there's no money. In truth, pregnancy is not an emergency. You've had 9 good months to plan for your delivery. So it's safer to be intentional about it, right? They now meet these unexpected challenges and they need to be transported or to be referred to a hospital. They are looking at you and I don't have money. It's heartbreaking. We need to empower ourselves as females, so that even if the man is not there, some will even tell you, my organ never come, and they wait for him. The baby is not waiting for you. The baby's life, the insults to the baby is not waiting for you. You should get to a point where you can take some decisions and then let him come and continue probably from where you stopped, right? You should attend antenatal care. Take your medications when you should. For specific prevention, you want to ensure that, for the fact that you're attending your antenatal care at a good place, if there's hypertension that is noticed, it's to be treated. If there's hypotension, it's treated. If there's bleeding that is noticed, it will not be a surprise that you started bleeding at night and they're looking for a way to take you to. You go to one hospital, they reject you. You go to another hospital, they reject you. The fact that you've registered at a proper place, they should be able to know what to do, whatever the situation is. So specifically, we're able to address the problems that can cause perinatal asphyxia in these children. So for us as doctors, we want to ensure that there's prompt diagnosis and early treatment for these moms and the babies. So if you have a skilled doctor attending to you, whatever situation you see, if there's fetal distress, you want to carry out a cesarean section as soon as possible. If the mom needs to be transfused, you do that. As the cesarean section is going on, there's a pediatrician standing by to receive the baby and resuscitate the baby immediately and begin the proper management for these babies. If, for one reason or the other, these babies come and the damage has started or the insult to the brain has commenced, well, you won't throw the baby away. We will still do what we have to do. So we begin to manage the situations that we come across. So the baby is convulsing, you give medications, if the baby is already having kidney problems, the things we do to ensure that it can be curtailed. If the baby is unable to feed at that point in time, we are not in a hurry to feed. Nothing will happen to the baby. So long as the baby is getting adequate IV fluids, maybe it's fine, right? So we do the specific things we can do to ensure that the baby can recover to some extent, right? But if the damage is permanent, you can help this baby to be rehabilitated back into the society. And then if there's a renal damage, you may want to do dialysis. If the baby is blind, you want to help with sight aids. If it's a hearing problem, you want to help with hearing aids and all that. So as an intending mom, you have a huge role to play in preventing perinatal asphyxia. Attend your antenatal visits at a good place and ensure that you have a professional taking care of your pregnancy period. Ensure too that you have a skilled birth attendant to take the delivery, and you have a pediatrician to receive your baby. That golden minute, like I said, is a game changer. If the right thing is done at that particular time, it can prevent so much problems in the future. Eat well, get good nutrition, stay hydrated, do not smoke, avoid alcohol and hard drugs. This is not the time for that. And ensure that you give your child the best start in life. I really hope that you have some good knowledge now about perinatal asphyxia and that you can even educate other people around you. I believe that this will make a change and a difference in our children. Do have a great day. And remember that pediatrics is my passion, it's my pride. Thank you.
Tenderly touching lives with tender care.